And what we do here is basically what the plan that was revealed to us in our inspired councils about having a city work, trying to reach the people of the city through the entering wedge of the health work, and at the same time having a retreat in the country where people can be taken out of the city, enjoying the beauty of nature, getting in touch with the God of creation, and having the capabilities of working with God's hygienic remedies rather than just simple drug medications, hydrotherapy, the botanical medicines, lifestyle interventions of nutrition and exercise, and these others. And people really enjoy coming away for a time and being in a quieter place without the stresses of their business, sometimes their family life, and being able to connect with Jesus. In working in this kind of ministry, there is strength as we unify. And that's what God really wants us to do. So we feel like we're brothers and sisters with each other. We're all doing the same work, God's work, but it's nice to be able to come together and share our experiences and learn from each other. I started my medical internal medicine residency in '73. I then spent a couple of years at the Center for Disease Control in Atlanta. That's how I got to Georgia as a public health service officer. And then I went back to Emory, where I did the rest of my medical residency. And after that, I went into private practice in Atlanta and practiced there for about 12 years in just internal medicine. During those years there in Atlanta, I became a Christian. I wasn't one when I started, and I was in another church and enjoyed that fellowship, but I felt that there was still something lacking. I was studying the Bible, and I could see that we weren't really following all the biblical principles that I was reading and studying about. And so I got a little flyer in the mail, and it was from the Seventh-day Adventist. I'd never heard of a Seventh-day Adventist. I didn't know what this was all about, but went to the prophecies. It was a Daniel seminar. And so for 10 weeks, one night a week, we were in the Marriott Hotel there in Atlanta, and I learned all these beautiful truths about Jesus and the prophetic messages for the end times, and my heart just thrilled within me. And so I started attending the Adventist church and then later became baptized. And it was after that that I was introduced to the Adventist health message. And I could see that what I was doing, again, was not in harmony with what God's plan was for physicians. And so I was invited to come to Wildwood, which was about 2 hours north of Atlanta, by some of my friends and associates. I went up there, and then I began to see how this could be done, really. I knew what I had been doing in the hospitals there in Atlanta, but to do these hygienic methods, hydrotherapy, botanical methods, you can't do that in regular hospitals. They're not open for that. So while I was there, I met Dr. Agatha Thrash and Calvin Thrash. They invited me to come to Uchee Pines on the weekend. I would still do my internal medicine practice in Atlanta during the week. And over some time, I got to see how this work could be done in a sanitarium setting. So it was probably maybe 5 or 6 years later that I actually came to Wildwood and joined the staff there, because I had friends also there, and was training under older physicians that were there, Dr. Harold Cherney and some others. And so I got a chance to see, to learn, and to practice these methods. And then I really didn't intend to stay all that long. I had maybe some other plans, but 25 years later I was still there. And so I really enjoyed my experience there at Wildwood, and that was the prompting, really, in my heart for coming up here to Missouri and trying to start another center where we could do the same thing with people that didn't have the advantage of a Wildwood or UG Pines close by, and that we could enter a new field, and not only with introducing God's health message, but helping people to understand the love of Christ and what He wants to do in their lives for them. The orientation here is also a very specific disease-oriented approach. If they have diabetes, we are working with them in terms of managing their medications, their insulin dosages, and having to monitor that as we introduce lifestyle and they get better. We're having to adjust all of this. We have a number of people that are coming with diabetes, with other associated disease processes, like coronary artery disease, heart failure, those things. So while we are concentrating and emphasizing the matter of lifestyle interventions, we still have to take care of those medical needs that patients have. And this is very important. We do have a hospital which is about 5 or 6 miles from here. There we can do all the standard testing that we need to, whether it's imaging, blood work, just about anything that we have to do to come up with better explanations for what their symptoms are if it hasn't already been diagnosed. So we want to make this center a healing center, not just from the standpoint of education, but also medical intervention using the best of conventional methods along with what we need to do with the simple hygienic methods of botanicals. And it's not that we never use drugs. We have people come here on a lot of drug medications, and we can't just take those drugs away. We've got to work with them, and then as they're introduced to a better lifestyle, then the medications become less necessary, and we can gradually start to taper them as we're working with other botanical medicines. But it is a thorough medical directed program as well, supervised. So we're watching these patients, and then we have people that are coming with, let's say, depression or anxiety, some of these emotional disturbing things. And we have our members of the staff that are certainly working with them, giving them not only counsel from good medical sources, but biblical counsel of how to overcome these problems. And then working with their medications, because many of these patients that come are on all kinds of medications. They're having side effects from them. They're not feeling well, and they don't really understand what all these medications are doing. So we're trying to work to gradually reduce those medications when it's safe, and just to watch them and make sure that they're improving, and they usually go away feeling so much better with less medication, and some will come off of medicine totally, and that's what we enjoy seeing. But for 11-day plan, we're teaching them what they can do at home, following up with their practitioners at home, and if they're open, then they can continue to improve following this plan when they go home. In follow-up to our community work, we recognize that while we do see patients and guests here at the Lifestyle Center, we also see outpatients here at the center. That cannot be our sole focus. That as physicians and other health workers and the lifestyle centers, that we have a larger responsibility, a larger outreach that the Lord has told us, that we are to actually send workers into the city to be able to engage people and work with them, certainly concerning their health matters, but also trying to introduce them to the Adventist network of churches and their work there and evangelistic meetings and so forth. That's very important. Ministers, physicians working together. And we've tried to do that, and the Lord has been very gracious and opened doors for a lot of interaction there with the St. Louis community. That is our city that we are targeting for this health work. So we spend a fair amount of time up there. We've been on the radio there with one of the churches that have a radio station doing health talks for the people of St. Louis, introducing them to God's prescription for health and how they can enjoy a better health with the Lord's plan. We've done topics on different diseases that people need to learn more about: diabetes, cancer, heart disease, and how they can begin to turn their life in a direction for healing with the Lord, what His plan is. And it's just been a beautiful picture of how God intends the medical work to channel through the churches. We're not to be striking off trying to do an independent work. This work is part of the church. And that's what we have enjoyed, is working with our brothers and sisters, pastors, and health leaders in the churches.